Hello, my name is Jasmine, and we're going to be talking about the non-respiratory air movements. Um, Air movements other than breathing are called non-respiratory movement. These non-respiratory movements result from reflexes that are also sometimes initiated voluntarily. Movements like coughing, sneezing, laughing, crying, hiccups, yawning, and speech. Okay, during coughing, a deep breath is taken, which closes the glottis and it forces air to move upward from the lungs against the closure. Then again, the closure suddenly opens and a rapid flush of air is forced upward from the lower respiratory tract. On the other hand, sneezing is the same concept as coughing. The only difference is that it clears the upper respiratory passages rather than the lower ones, which coughing clears the lower ones. These two air movements function is to clear respiratory passages. FYI, the glottis is the space between the vocal folds, which you can see right here. Laughing and crying, on the other hand, are only deep breaths that are released in many short expirations. The function for these two is to express emotions, so laughing, happiness, and crying, sadness. Hiccups, there's a sudden inspiration when the diaphragm contracts with this spasmodically while the glottis is closed. That the sound that we're able to hear is because of the airstrike with the vocal folds. During yawning, just a deep breath is taken. The hiccups and the yawning, the function is unknown, so we're not really sure what they're useful for. Another air movement is speech. During speech, air is forced through the larynx, which are in specific patterns. The vocal cords then vibrate and make sounds. The forming then of words is due to the lips, the tongue, and the soft palate. The function for speech is obviously vocal communication. Okay, this is my works cited. Thank you.